Welcome back to Untold Physio Stories podcast. And when your host, Dr. E with Modern Manual Therapy, Edge Mobility System, and our 4-month online mentoring program, Modern Rehab Mastery. My co-host still is not with me, but today I am catching up with like one of the OG PT influencers before influencer was even a word. It's Dr. Zach Cupples. Zach and I go way back. He got me a book once, I think. Why don't zebras get ulcers? Did you give me
That
that?
yes, yes, I did. Yeah, by Sapolsky. That was like the book back then.
Right, it was. It was. I don't even know if I read it, but I remember you gave it to me. I have it on my dresser somewhere. I don't know.
Hey, there'll be a time when you're going to be ready to read that book. I'm a big proponent of just in time learning versus just in case.
Awesome. All right, say let's uh let's have a quick intro, and then I know you got a couple stories for us.
Yeah, so my name's Zach Couples. I'm a physical therapist and strength coach based out of Las Vegas, Nevada, and the internet. So my main business is zachcouples.com, where I teach seminars. I help people remotely with training, mentoring, and movement consultations. And I produce a lot of content for free to help educate both clinicians and the public. And then I also do physical therapy and training out of Elevate Sports Performance and Healthcare in Las Vegas, Nevada. And that's pretty much my life.
All right. And that wasn't his story because that would be pretty uninteresting. So what's the story?
Oh man, have I got some stories for you.
All right.
So yeah. So last year was, this is 2023, it's 2022, was like the biggest differential diagnosis year of my life. So I had two people, and it's important that I tell both of these stories because each sort of failure in each of those helped me learn for the next one. So there's a woman who I train remotely, and she's super muscular, very strong. Drops a kettlebell one day. Well, that's kind of weird. Next day later, couldn't raise her arm overhead. Huh. That's very bizarre. Are you hurting? Yeah, neck hurts a little bit. Next day, couldn't bend her elbow. I saw her remotely. I had her do Hoffman sign, which is where you flick the nail bed. Thumb moved. It's positive. I'm like, crap, you have to go to the ER now. And so she went to the ER, and I just told her, hey, go to the ER. And I didn't really educate her on what to say or anything like that because I
Mm.
had made the assumption that they should know what's going on if you tell the symptoms. That was a poor assumption because she ended up getting sent home that day. They just thought she had neck pain, gave her some muscle relaxants. And I was livid because I was staying up with her, making sure that she got taken care of. And I'm like, yo, you cannot leave. You absolutely cannot leave. And they let her go. And she ended up going to see a neurosurgeon shortly after, did the MRI, found out that she had cervical myelopathy, emergency surgery very quickly. And I learned that day that when you're making a referral of any kind, you can't assume that the practitioner that you're sending to is going to get the job done. And so you have to be very specific about what you tell those people, and you have to coach up your patients. Even though, like, I feel like that's something that an emergency room doc should be able to screen out for and know, but you can't always make those assumptions. And I think it was tough for me because in physical therapy school, you always had to toe the line of like, oh, we can't make a diagnosis, we can't upset the doc and tell them how to do their job. But when it's a person's life on the line, like you can't be afraid at squashing egos. And so months later, with that in mind, I had a gentleman come in to see me. I had seen him earlier in the year for lower back pain. I couldn't get anything to change. And I'm like, man, something's up. You need to get an MRI because this just doesn't seem right. Got the MRI. It didn't really show anything. Or, I mean, it showed like, normal age related changes. Sees me again because he was back in town. He's like, yeah, Zach, this just feels different. Like my legs are kind of hurting every which way, like all around. And it just, something doesn't feel right in my body. And I asked some other probing questions. I'm like, have you had any changes in bowel and bladder? And he said, yes. And he's like, yeah. And I think my calves have been getting smaller. And I'm like, oh, I thought for sure this guy had caught equina. And so I'm like, hey, man, look, here's what you have to do. You have to go to the ER now. But I changed things from the last time I had to send someone to the ER. Instead of saying, just go to the ER and tell them your symptoms, I texted him a list. You have to tell him that you're feeling this, 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 and this. And you need to have these tests checked, which was an MRI. And I believe it was like a CT scan. I forget what it was. But I had that whole list. But I didn't say cauda equina because, again, we're not supposed to diagnose.
Oh, man.
And yeah.
It's been a long time since I thought that.
I know. Well, it's like, and it's funny, like these were once in a lifetime cases, and you don't always have referrals like that where you're suspecting a certain diagnosis, unless it's like, oh, this person probably tore their ACL. Well, that's gonna, a good ortho doc should be able to determine that. But these were not like, traumatic events. And so he goes, gives them the list. They actually got him in fast. But the emergency room doc was thinking, oh, this is nothing, probably. We'll just send you home. Muscle relaxers, do PT.
Oh,
got the MRI. But got the MRI.
With those
clear
symptoms,
case
with that
cauda
symptom,
equina.
sometimes I feel like in both of these cases, if you're giving the doctor the benefit of the doubt, this is what my co-host always does, because I'm always like raging at people, right? And my co-host is like such a much nicer guy than me, I feel like, because I always feel like, oh, how can someone miss this? It's like obvious, right? And he always says something like, it's very possible that the patient didn't entirely relay the whole thing, or they gave them the list and they assumed they read it, but they didn't actually say, like, I have this, this, and this. They gave them a list and it just got put away. You know what I mean? Like that.
Yeah.
That's I feel like something like my co-host would say. Meanwhile, I'm like, oh my gosh, like it's ignorance.
Yeah.
So what happened?
Yeah.
Sorry, didn't mean to interrupt you.
Yeah. No. So got the MRI. It's like, oh yeah, you need emergency surgery now. Ended up getting emergency surgery.
Okay.
But having the symptoms, he did initially get ignored by the front office person, but then the nurse read it and was like, no, you got to get back here immediately. But it was interesting. And I think honestly, the only reason why they got back fast, aside from the list, was he had said, my doctor had told me to come to the ER for this reason, not my physical therapist, but my doctor.
Yeah, same thing. Same.
Yeah, which it is. But had he said my physical therapist,
oh
you
yeah,
have to wonder, like, they don't know
must be a
anything.
muscle strain. This is quite a severe muscle strain.
Yeah.
That literally never happens in the spine. It's like, man, I have a low back strain. I'm like, man, this is the last time someone strained a lumbar erector muscle. Literally, like, when have you ever seen a lumbar strain? Like, you can strain a lot of things. People don't seem to strain an erector,
Yeah, I mean, maybe deadlifts occasionally, but
I don't know. I feel like I hurt my lat or my glute or my hamstring something before doing a deadlift.
Yeah, perhaps.
Yeah.
But I would say with those two stories, like the biggest lesson I learned, and actually my buddy Max Jones, who's a trainer, he put this eloquently because he's in the military, so he has to do some diagnosis-based stuff, is like, hey, I'm seeing this, and this. I want to rule out if this is this condition. Can you do that and look at these tests? And I think that's probably the best way that you can approach maintaining a good relationship with another provider while still making sure that you've done your due diligence to protect the patient.
Yeah. Yeah. Awesome stories, man. Great learning experience. That's like, a good message for people who refer out. You can't assume that you can give someone too much information. And actually, my next podcast that I might have to record by myself, I had a very similar experience, but I gave the provider, who just happens to be my close friend, every single thing that I think she needed to hear, because a doc from her office basically referred this guy saying he had TMJ. And by the time the guy came to see me, I thought he was like one sneeze away from having a stroke, just because he didn't have an ear infection. But that's for the next episode. Where can people find you, Zach?
You can find me at zachcupples.com. That is the main hub where you can get access to my blog, all my services, links to my seminar. I'm also on every social media. YouTube, search Zach Cupples. Instagram is Zach ZAC, Cupples CUPPLES. Twitter is at ZCupples. I think I'm on TikTok too, but if you just search my name and physical therapist, chances are you'll probably find me.
Yeah, this guy's got some great thumbnails on YouTube. You're going to be entranced by his YouTube thumbnails.
The videos are terrible, but you'll be like,
Yeah,
man,
hey
these
man, you're going to click
lit.
on them. You're going to click
That's
on
right,
these
darn it.
thumbnails. Yeah, for sure. Hey, it was great catching up with you, Zach.
Good catching up with you too, man.
All right. Hey, if you like the story of anything similar, anything to say, reach out to us and make sure to rate Untold Physio Stories 5 stars wherever you listen to podcasts. Hit that subscribe button. And as always, you guys have a great day.